name's Sylvia.
I'm Ken.
I'm Denali. Everyone close your eyes. Imagine you're pregnant, or your spouse and girlfriend is pregnant. You all go into the doctor's for a checkup, and the doctor says that your baby has tetrasomy 13q mosaic. You'll have no idea what this disorder is, but the doctor says that your baby could come out of the womb with skin discoloration, deformities, I already said skin discoloration, mute, blind, deaf, and that your baby will have a short life expectancy, so they recommend to terminate the pregnancy. But y'all decide to keep the baby anyways. Y'all go through tests to see what has caused your baby to have this disorder, and it turns out it's completely random. Because it's so random, there's no way to know that you or anyone you know's pregnancy could result in this condition. It's important for y'all to be informed about it because it impacts so many lives, and I learned that through being a caregiver. I'm actually a caregiver for a little girl with this disorder, and that leads to why I am credible. I am lucky enough to take care of Elle, a little girl who has tetrasomy 13q mosaic. Her parents gave me case studies and articles that I have read over that have taught me more about this disorder, and I have learned a lot about Elle, the daughter who has it, because I had an interview with the mother. Tetrasomy 13q mosaic is a rare disorder with one commonality, and that is seizures. To truly understand tetrasomy 13q mosaic, it's important to know what it is, its effects, and the treatments for it. First, let's take a look to see what tetrasomy 13q mosaic is. According to Dar, Robbins, Furman, Levy, Patel, and Scaglia's journal titled Tetrasomy 13q Mosaicism Associated with Thyroid Hypomelanosis and Preconscious Puberty in May 2009, it states tetrasomy is a form of aneuploidy, which means presence of having an abnormal number of chromosomes in a cell, with the presence of 4 copies instead of two normal of a particular chromosome. And according to the Chromosome Registry and Research Society article titled Mosaicism, it says, tetrasomy is a form of aneuploidy, presence of having an abnormal number of chromosomes in a cell with the presence of 4 copies instead of the normal 2. Therefore, someone who has tetrasomy 13q mosaic, some of their cells have 4 copies of chromosome 13, while the other cells have 2 copies of chromosome 13. Now that we know what tetrasomy 13q mosaic is, let's look at its effects in some of the cases of those who have this disorder, including the little girl I'm a caregiver for. As I mentioned earlier, I am a caregiver for a little girl named Elle. I had an interview with Sharon Florence, mother of Elle, who was diagnosed with tetrasomy 13q mosaic, on February 20th, 2017. I asked Sharon several questions, including, was she born with any skin discoloration, extra limbs, or other deformities? What complications has Elle had throughout her life so far? What kind of things do you do as a parent to help her? How many cases did the doctor tell you there were in the world of tetrasomy 13q mosaic? And her answers were that Elle was actually born with 6 fingers. Elle has a salmon-colored patch on her forehead and on the back of her neck. She cannot talk whatsoever. She can make noises with her mouth, but she can't respond with words. She understands what we're saying, but she only can respond with the click of her mouth like this, and that means yes. But if she doesn't want something, or you ask her a question and the answer is no, then she won't say anything at all. She'll just ignore you. Elle has seizures at least once a day. The most she's had in a day is 20. It's super hard for her to sleep. She does have to take medicine for her to go to sleep, so that's what they do as parents, is that they help her. They get medicine for her to help her sleep and also prevent seizures, to try and prevent seizures. And she uses a device to talk. she goes to therapy for that so she can communicate through this device, but she hardly uses it. Now that we have looked at tetrasomy 13q's effects and cases, let's see. Sorry, there's one more case actually that I wanted to go over. According to Haddad, Abora, Tosca, Guedesh, Mas, Lahermin, Drort, Picon, Brissett, Tosh-Dejean, in their clinical report of 2012 titled Tetrasomy 13q due to an inverted duplicated neocentric marker chromosome, a case in which the parents found out before the baby was born and terminated the pregnancy. A 22-year-old Caucasian woman was referred to our prenatal diagnosis center at 12 weeks. When she had an ultrasound examination, they found cysts in the fetus neck and intrauterine retardation. This was the first time they had found something going wrong with the healthy parents. At 14 to 17 weeks, they found that the fetus had enlarged kidneys, short long bones, and cerebellar hypoplasia, which is when the cerebellum, the part of the brain that controls the motor skills and coordination, will not be completely mature at birth. After genetic counseling, the pregnancy was terminated at 17 weeks. In the interview, I also asked Sharon Florence about her pregnancy with Elle, and she said that the doctors told her that they would be the first parents to keep their baby after they had found out that their baby had this disorder before it was born. All the other parents that had found out that their baby had this disorder before they were born had terminated the pregnancy. And in the other cases, the baby was already born and they didn't find out till later. And so now that we've looked at tetrasomy 13q's effects and cases, let's take a look at the treatments for the effects of this disorder. This disorder is not curable, but seizures can be treated as well as therapy sessions can be taken place to help with abnormalities and intellectual delays. According to RxList website, rxlist.com, article titled Clonazepam Drug Overview and Uses for Patients and Caregivers, it says, to help with seizures, the patient can take a pill called clonazepam 3 times daily. Clonazepam is used to prevent and control seizures. Clonazepam works by calming your brain and nerves. For therapy, in the interview I had with Elle's mom, Sharon Florence, on February 20, 2017, according to Sharon Florence, Elle goes to physical therapy and speech therapy once a week. It has helped Elle tremendously with her walking. Elle was not supposed to be able to walk, but now with physical therapy she's able to do so. As for speech therapy, since she cannot talk and not communicate actual words, she goes to speech therapy for her device. In conclusion, so now hopefully you know and you better understand what tetrasomy 13q mosaic is and involves. After learning its effects, treatments, and cases, you can be better prepared or inform others of tetrasomy 13q mosaic. Taking care of Elle is a whole new level of parenting preparation. She's not like other kids where they'll just fall asleep easily when they're tired, or I have to actually sing her to sleep. She can't do many things on her own. She has taught me so much patience, and knowing this disorder has prepared me for being a parent and the random events life can bring. Thank you.